In this video, I'm going to break down exactly what we currently know about asthma from science, and I'm going to specifically focus on the points that are important for healing the disease. And I'm also going to add some of the newest findings from science that you probably don't hear anywhere else that explains one of the biggest puzzles about this disease. So asthma is basically the disease of lack of oxygen. It affects the respiratory system, particularly the smaller airways called the bronchi and bronchioles. And first up, very important, science still doesn't know what causes the disease. This is their words. And they're basically saying that, yeah, we believe it's a combination of environmental and genetic factors that causes this disease. And all that, despite the fact that 300 million people worldwide have asthma. Now, I might not know every single thing involved in the pathway, but I have been able to make huge differences in healing my mother who has asthma using things with barely any side effects. So typical symptoms of asthma are chest tightness, or sometimes also chest pain, wheezing, coughing, and shortness of breath. At its core, those symptoms come from the narrowing of airways. Common in asthma are excessive mucus production and inflamed and swollen airways. So you basically end up with a very, very narrow airway, and this is really where all of these symptoms come from. Most asthma is triggered by external sources like dust, pollen, mold, etc. And then increased and inappropriate activation of the immune system in response to these environmental factors contributes to the symptoms. So basically the narrowing of airways. And understanding this is going to be key. To heal asthma, you have to realize that the immune system is a big part that we have to focus on. There are different forms of the severity of the disease, and they range from mild to basically very severe. When you have the more milder to moderate cases, then you usually have cases where people don't have high healthcare utilization. So basically they don't have a need for daily medication use. In many cases, they only have the emergency medication because they might have 1 to 2 asthma attacks a year. Then when you get to the more severe cases, you're gonna have cases where people have a chronically narrowed airway and have the need for a daily medication use. Usually inhaled corticosteroids, or in the more severe cases, then you're gonna get to the oral corticosteroids like prednisone, for example. And occasionally they typically also need the emergency medication because they have asthmatic attacks. This is also, in the very severe cases, is also where you're gonna find people that basically don't even respond to most corticosteroids or just to most medications anymore. And this is again the point that we will focus on near the end of this video. This is what the new research has really shown now. Now, what's an asthmatic attack? It's basically a sudden worsening of all the asthma symptoms. So your coughing, wheezing, shortness of breath, and chest tightness just suddenly gets worse. How you're really gonna notice most asthmatic attacks is that people, they start to hyperventilate and they might have such a bad shortness of breath that they can basically not speak, eat, or sleep anymore. And this is how you're really going to notice it. Then this gets into panic. You might have a racing heartbeat. You might get heat waves. You might get diarrhea from all of the stress. You might have drowsiness, confusion, exhaustion, like of course, due to all of the panic, and you are just not getting enough oxygen anymore. You might have blue lips or fingers, and in very bad cases, you're gonna have fainting. This is where you're gonna have to use the emergency medication, and sometimes you just can't even get that in anymore. So basically just do what your healthcare professional told you, or like call an ambulance if it's really bad. Now the key thing here for us to understand is, where do all of these things come from and how can we really heal this disease? One type of immune cell called T helper cells helps to organize our immune system to fight off pathogens, which are the bad guys like viruses and bacteria. One specific type of T helper cell called T helper 2 is present in asthma in high amounts in the lung, and you're not supposed to have T helper 2 high in your lung. So people without asthma do not have T helper 2 present there at all. Interesting is that when one type of T helper 2 or T helper cell is higher, then you're also going to realize that another one decreases. So you're supposed to have pretty high amounts of T helper 1 cells in your lung. But in asthma, because you have T helper 2 higher, the T helper 1 decreases. So it's almost like a balance. This T helper 2 produces so-called cytokines, and those are the real weapons that are typically being used against invaders. And the specific cytokines are called interleukin 13, interleukin 5, and interleukin 4. Now those interleukins, those cytokines are what really destroy the pathogens. And this is what's being released in excess in asthma. So this is also, maybe you've heard that before, local IgE production, histamine, all of these things play a role in these pathways. But basically, your immune system, your T helper 2 cells, and basically like your entire immune system is being triggered by an external source like dust, pollen, etc. And those T helper 2 cells release these cytokines, for example, interleukin 13, and they then try to attack this invader, or for whatever reason it released those cytokines. Now what's going to happen is, in most cases, these cytokines start to build up. So it's almost like your immune system is shooting everywhere. And those things start to build up, and in the end they attack your own tissues. They cause this inflammation in your lungs. And this is also why asthma is by some people just being referred to as an autoimmune condition. Asthma is commonly presented in childhood, although not always, and is usually associated with conditions such as hay fever, eczema, allergies, and GERD. Most asthma symptoms also get worse at night, and many asthmatics also develop obstructive sleep apnea. Now those are all clues on how this disease is really created. And the cool thing about it is that it actually tells us that this really comes from a main source, which basically connects all of these things together. And this also means that this disease is fixable in many cases. Now, new research has shown that not every single person has this sort of, what I just explained to you, high T helper 2 cells, and therefore also this certain cytokine called interleukin 13. But there is a completely different form of asthma. And this is very, very important, especially for the severe cases that aren't really reacting to the asthma medications anymore. So there's a variation of asthma that doesn't have T helper 2 high, but therefore another T helper cell high called T helper 17, and again, this is not supposed to be present in the lung. This T helper 17 also makes a cytokine called interleukin 17. So not to be confused. But anyways, it's not super common. So most people have this T helper 2 high model, but then some people have the Th17 high model. And as we discussed before, when T helper 2 is high, for example, other like T helper 1 is lower. And so is it with T helper 17. So you can only be either T helper 2 high or you could be T helper 17 high, but you could never have both high at the same time. And this is just basically another variation. Maybe there are even more variations than this type of asthma. When we take a look at the medications, like inhaled corticosteroids, it's important to note that it helps many asthma patients, especially in the beginning. But many patients in the long run redevelop asthma symptoms. And we weren't really able to explain that with science before, but now it all starts to make sense why that is happening. Because when you look at it, then you're gonna realize, yeah, when you have Th2 high, then glucocorticosteroids are going to help you. But Th17 high cells are notoriously resistant to glucocorticosteroid action. So now we have this new form of asthma that is probably occurring because of the way we are treating the current asthma, or the Th2 high asthma. And now pharmaceutical companies are working on new medications that treat the newly occurring asthma form. So if you're getting a little bit tired of this game, then I completely feel you. And the truth is that there's a way to suppress both Th2 and Th17 cells naturally. And overall, there are promising ways to cure asthma naturally when you start to combine things. And my mother has been suffering from asthma for years and years, and she was only climbing in the medication ladder. She basically tried everything until one day I found something really big and we changed everything. And we basically found out how to cure this disease naturally. And if you want to know how you can cure this disease naturally, then check out the video that pops up on your screen right now. And by the way, the science to all of the things that I said is linked down below.